My friends, let me ask you a very interesting question today. What do Albert Einstein, Walt Disney, Steven Spielberg, Keira Knightley have in common? Think. Not sure? Well, the answer is that they are very famous, successful, and dyslexic. And what is that? In today's episode, let us learn about this neurological condition called dyslexia and spread awareness about it amongst our friends and family. Zoom in! We live in a world full of unique and different people. People with different eyes, hair, skin that gives us distinctive personalities and functionalities. But there is one element that we all possess that looks the same but functions differently. And that is our brain, that can see and understand the world differently for different people. One of those ways is through the perspective of dyslexia that affects our ability to read, spell, write, and speak clearly. Unfortunately, people with dyslexia are often misunderstood as not so intelligent. But remember, my friends, that is not the case at all, as it has nothing to do with intelligence. And it's just their brains finding it challenging to process specific tasks at a reasonable speed. Yes, my friends, despite having normal and even high intelligence, a dyslexic person may show certain symptoms, such as difficulty in remembering the right names for things, problems with directions like telling right from left or up from down. They may need more thinking time to remember the right word, and for some, it could be challenging to hold a pen or write by hand, and much more. But the main problem in dyslexia is trouble recognizing phonemes. For example, the basic sounds of speech like B in bat and P in pad are often mixed with one another. But the most crucial question is, what makes a dyslexic person so unique? Well, to know that, we need to enter their brain to analyze the whole situation. As we know, the brain is divided into two parts. The left hemisphere takes care of processing the language and is the more academic and logical side of the brain. And the right hemisphere is the more artistic and creative side of the brain. Scientists have studied that brains of those with dyslexia rely more on the right side of the brain and frontal lobe as compared to the brains of non-dyslexic people. This means when they read a word, it takes a longer route through their brain and can get delayed on the frontal lobe. And because of this neurological condition, they find it challenging to undertake tasks depending on the left hemisphere of the brain, such as reading, writing, solving math problems, etc. But here is the good news. A person with dyslexia may see things differently, but it could really work in their favor as well. Yes, even though they struggle with reading, they can be very good with painting, inventing things, singing, telling stories, and making people laugh. And eventually, just like many other successful and revolutionary dyslexics, they have the ability to see the bigger picture. Trivia time! Did you know the word dyslexia comes from two Greek words, dys, which means difficulty, and lexis, which refers to language or words. Also, the dyslexic brain is actually larger and typically much more creative than the average brain. Remember, my friends, next time if you see your friends or family members struggling with reading or writing, make sure to understand their situation and help them to realize that it's absolutely okay to be that way. Don't tease them or bully them, because you never know, you might be looking at tomorrow's Einstein or Da Vinci or Whoopi Goldberg, or even better, their unique self that has the power to change the world. Think about it. Until next time, it's me, Dr. Binocs, zooming out. Hey, little kitty, do you know where I left my car keys?
No, Doctor.
Gosh, why can't I seem to remember it? Wait a minute. Actually, the real question is, why do we forget things in the first place? Hey friends, I'm sure just like me, we all tend to forget things every now and then. So, in today's episode, let's sharpen our brain and answer an unforgettable question. That is, why do we forget? Zoom in! Hey friends, remember that fun birthday party of your bestie you attended last year? Do you? Great! Now try to remember the outfit you wore 5 days ago. I'm sure most of you might find it challenging to remember the outfit and have forgotten about it. But why? Why do we tend to forget certain things so easily? To know why do we forget, first, we need to learn about our memories that are a part of your complex and multi-talented brain. When you undertake certain activities, for example, reading a new book, your brain gets active and converts that information into a pulse of electric energy that travels through the network of neurons to the short-term memory area, where it is stored for hardly a couple of minutes. Then, if your brain thinks that certain information is important enough, it transfers the data to long-term memory through the hippocampus, an important part of the brain that processes memories. And finally, the hippocampus then moves the data across different areas of the cerebral cortex for permanent storage. Now we know how we remember things. But the critical question is, what was the question? Oh yes, why do we forget things? Well, that's because there is no need for us to maintain everything in our brains. Yes, my friends, short-term memory has a fairly limited capacity. It can hold about 7 items for no more than 20 to 30 seconds at a time. So, whatever information our brain perceives as less important is eradicated from its system, saving it from getting overloaded. And the information that is very important for us is eventually transferred from the short-term area of our memory to the long-term part that has unlimited capacity to store where it stays for a longer period. Remember friends, it's absolutely normal to occasionally forget things, like the name of someone you just met or where you left your phones. And of course, everyone has forgotten an answer on a test. Also, it's typical to forget things as we grow older. But if you find yourself forgetting things every now and then, There are several steps you can take to keep your brain healthy and retain your memories. Just try to stay physically active by exercise or playing. Also, do not forget to eat healthy food as your brain needs the right nutrients to keep working effectively. And finally, give your mind a good workout session by solving puzzles, learning new languages, and exposing it to new challenges to keep your memories intact till infinity and beyond. Trivia time! Did you know certain memory problems could be severe? Yes, such as when a person has Alzheimer's disease. In this disease, deposits build up and nerve cells stop working, leading to memory loss. Also, other reasons such as chronic stress, depression, isolation can also affect our ability to store short-term memories. Hope you enjoyed today's episode. Until next time, it's me, Dr. Binocs. What was that word?
Zooming out!
Oh, yes, I forgot. Never mind. Where is it? Where did I keep it?
What you looking?
Well, do you remember where I kept my specs?
No idea.
I keep forgetting a lot lately. I think I should get myself tested for Alzheimer's.
What's that?
Well, that information I do thoroughly remember. So, in today's episode, let us try to understand this forgetful question. What is Alzheimer's disease? Zoom in. Forgetting is a part of everyone's life, and it gets more common as we grow old. But on some rare occasions, after the age of 60, this forgetfulness turns into a severe disorder called Alzheimer's, a condition that permanently affects the brain. Yes, in this state, the affected person starts to lose memory and can even forget the names and faces of close ones. They also lose their thinking skills and the capacity to carry out easy tasks like how to tie a shoelace. They even see or hear things that are not there, lose their way, have trouble sleeping, or say the same things over and over. Overall, this is a very unfortunate state to be in and can cause them to become frustrated and angry with you for no reason. However, it is very important to know that they do not mean to treat you badly. It's just that Alzheimer's disease makes the person act in this unfortunate way. But the vital question is, what causes this disease in the first place? Around 1901, Dr. Alois Alzheimer, a German psychiatrist, had a female patient with an unusual mental illness. After she passed away, he decided to examine her brain and saw many misfolded proteins called plaques and bundles of fibers called neurofibrillary tangles. These misfolded proteins are responsible for breaking down the brain structure by blocking signals and communications between cells. They also begin an immune reaction that causes the collapse of disabled nerve cells, because of which the brain can't process or store the information properly. Another major reason behind Alzheimer's disease is a component of neurofibrillary tangles called Tau. Its job is to hold together the microtubes that pass the food molecules to other parts of the brain. But in Alzheimer's, Tor gets unstuck from the tube which leads to its disintegration, stopping food nutrients from reaching the brain cells, which ultimately destroys them. But there is still a lot we don't know about this condition, because of which we are yet to find a cure for this unfortunate mental illness, and all we can do is help slow it down. On the good side, scientists believe that exercising, eating healthy, meditation, and keeping your mind active by playing puzzles may help delay the start of Alzheimer's disease. And here is the most important part, my friends. If anyone you know is suffering from this condition, they might act strange at times. But remember that it is not anyone's fault there. So please be kind to them, try to be patient, and show more love. Trivia time! Did you know that more than 6 million Americans are living with Alzheimer's? Yes, and by 2050, this number is projected to rise to nearly 13 million. Hope you learned something new today. Until next time, it's me, Dr. Binocs, zooming out. Where are my specs? Never mind. Oh, little kitty, why aren't you eating your food properly these days? Well, I think we should book a psychotherapy session as you seem to be quite depressed these days. It's normal to feel this way during such a mental state, but it's also vital to know about the scenario behind a condition called depression. So let's zoom in. Almost everyone feels sad and hopeless at times for many reasons. But with changing times and circumstances, those feelings go away on their own and you feel happy again. However, when it comes to clinical depression, it's not just feeling sad or low for a short time, but rather it's a mood disorder that lasts for weeks or even months. It can affect anyone at any age, and the person going through depression may become more self-critical and complain a lot. They may have less energy and effort, making even small tasks seem difficult. At the same time, they may not enjoy things they used to enjoy and may have changes in sleep and eating patterns. Not only that, some people may even have physical symptoms like headaches, stomach aches, and back pain. But the vital question is, what causes these drastic changes in our mood? Well, scientists are still trying to figure out the exact reasons behind depression. However, one of the most significant changes that occur in the brain during depression is a decrease in the levels of certain neurotransmitters like serotonin, dopamine, and norepinephrine, the chemicals that allow brain cells to communicate with each other. Another change that occurs in the brain during depression is a decrease in the size of certain brain regions like the hippocampus, which is involved in memory and learning, and the prefrontal cortex, which is responsible for regulating emotions, decision-making, and social behavior. Additionally, the amygdala, which is involved in processing emotions, is more active in people with depression, leading to feelings of fear, anxiety, and sadness. But unlike other disorders, depression is hard to detect at times because people might just look fine on the outside when, in truth, they must be struggling to cope up with their turbulent emotions.
Moreover, with so much stigma attached to mental illness, affected individuals may take over 10 years to ask for help. So, for those struggling with depression, it's vital to know that it's absolutely normal to seek medical help. And there are very effective treatments available for it, the best being therapy and medication. In addition, your therapist may suggest certain lifestyle changes such as regular exercise, healthy eating habits, and getting enough sleep to improve overall health and well-being. I understand that for people suffering with depression, taking these steps may seem like a daunting task, and you might even be hesitant to seek help. But please know that depression is a treatable illness, and with a little bit of willpower, you can overcome this low state and regain your power. And for those who notice the symptoms of depression in someone they know, it's important to understand that it's not their fault. Their abnormal behavior is a result of a chemical imbalance in their brains. Blaming them or comparing their situation with your own experiences or feeling a little low can make them feel more guilty and isolated. Instead, be understanding and kind towards their feelings and make sure to talk openly about depression. Listen to their thoughts without any judgment and encourage them to seek medical help. The more the people seek medical help, the better scientists will be able to treat it and erase stigmas around mental illness.
Trivia time!
Did you know, according to WHO, approximately 280 million people in the world have depression? Also, depression is about 50% more common among women than among men. Hope you learned something important today. Until next time, it's me, Dr. Binocs, zooming out. Oh, well, never mind.
Oh, little kitty, I used to think you were the most mischievous cat. But your cousins make you look like a meditating monk. Well, of course, but first we need to know if their high energy is linked to ADHD or not. So, let's zoom in. Sometimes it can be tough for any kid to pay attention, listen, or stay calm. But a few kids or even adults struggle with these things almost all the time due to a brain development condition called ADHD, which stands for Attention Deficit Hyperactivity Disorder. Though kids suffering from this condition may show different signs and behavior, ADHD can be narrowed down to 3 types, namely inattentive type, hyperactive impulsive type, and combination type. Let's look at them in detail, starting with the inattentive type, in which the kid may get easily distracted, may seem absent-minded or forgetful, and lose track of their things. The hyperactive, impulsive type of kids is constantly on the go, as they are very restless and may have trouble sitting still or staying quiet when needed. You may see them constantly jumping and running around the place in a way that may disturb others. These types of kids are known to make learning more difficult for themselves and other students due to their hyperactive nature. And the third
is the combination type, which, as the name suggests, displays the symptoms from both of the categories and is the most common type among kids. But the vital question is, what causes ADHD in the first place? Well, it's not exactly known what causes the brain differences of ADHD, but there's strong evidence that it is associated with low-level dopamine, the feel-good chemical our brain releases as a reward for performing certain tasks. So, as people with ADHD don't receive optimum dopamine, they don't feel motivated and easily get bored by things that others might find entertaining. Plus, many brain scans have shown that the prefrontal cortex, the part of the brain responsible for regulating emotions and controlling attention, is smaller in ADHD patients, resulting in impulsive behavior. Besides, kids also can be more at risk for it if they were born early, are exposed to environmental toxins, or if their parents or relatives suffered from it. But remember, my friends, it's normal for a little kid to be distracted, restless, impatient, or impulsive. So these things don't always mean that a child has ADHD. However, if any of the said symptoms occur on a consistent basis and doesn't seem to improve with time, then it's better to make a quick appointment with your doctor. Though there is no cure for ADHD for now, your doctor may suggest certain medications, behavioral therapy, or a combination of both to help manage symptoms and improve functioning. And the best part is, this condition can improve with time when kids get the right treatment, eat healthy food, get enough sleep and exercise, and have supportive parents, friends, and teachers who know how to respond to ADHD. Trivia time! Did you know symptoms of ADHD typically first appear between the ages of 3 and 6? Also, boys are almost 3 times more likely to be diagnosed with ADHD than girls. Hope you learned something necessary today. Until next time, it's me, Dr. Binocs, zooming out. Oh, never mind. Oh, you look quite anxious, little kitty. What happened? Well, I understand, and it's normal to feel anxious due to it. The problem occurs when someone gets anxious without any reason. Well, let me answer that by answering an anxious question. What causes anxiety? Zoom in. Imagine this. You're sitting in a classroom staring at a test that could not determine your entire future. Suddenly, your heart feels like it's trying to escape your chest, your hands start shaking, and your whole body feels like it's on fire. But don't worry. What you're feeling is actually a normal reaction to a stressful situation, and it's called the fight or flight response, which helps your body prepare to fight or run away from danger. But what if there's no danger to fight or run away from, and still you feel worried and fearful all the time? Well, if that's the case, then there is a chance that the person is suffering from an anxiety disorder. It's a mental health condition in which anxiousness can last for around or above 6 months and can make everyday tasks feel like a huge hurdle. During this phase, you might constantly feel your heart beating faster, your breathing becoming quicker, or your body getting tense. Furthermore, you may have difficulty falling or staying asleep, which can result in sleep deprivation. Not only that,
but it can also make you feel jittery, irritable, and even physically sick. Yes, the stress hormones released during prolonged periods of anxiety can weaken the immune system, making someone more susceptible to illnesses and infections. Plus, chronic anxiety has also been linked to high blood pressure, heart disease, and digestive problems. But the vital question is, what causes this issue in the first place? Well, for that, we need to zoom into your brain and look into a tiny almond-shaped structure called the amygdala, a tiny guard that's always on the lookout for anything that could harm you. So, when it senses a potential threat, it sends a signal to the hypothalamus to initiate the fight or flight response, resulting in the release of a hormone called epinephrine, also known as adrenaline, which causes your heart to beat faster, your muscles to tense up, and your breath to become faster. But in case of people with anxiety disorder, the amygdala finds it hard to distinguish between something that is mildly bothersome, like seeing a harmless cockroach, with something which is a real threat, like seeing a venomous snake. So your tiny guard can get a little too overprotective and keeps triggering the release of epinephrine, making you feel anxious and stressed all the time, even when there's no danger. But here is the good part, my friends. Though anxiety can be a tough opponent to tackle, it can be overcome and managed by the right strategies, like taking slow and deep breaths, practicing mindfulness, which is the practice of being fully present in the moment and paying attention to the sights and sounds around you, getting enough sleep, meditating, exercising regularly, or playing your favorite sports. And if your anxiety feels like a storm that just won't pass, it's okay to reach out for help from a mental health expert. These experts have the power of knowledge and tools to help you overcome anxiety and feel like your best self again. Trivia time! Did you know an estimated 31.9% of adolescents have an anxiety disorder? Also, it is more common in girls, with 38% compared to 26% of boys experiencing some form of anxiety disorder. Hope you learned something mentally beneficial today. Until next time, it's me, Dr. Binocs, zooming out. How did you return so fast? Didn't you have an exam?
Yes, it was an eye exam.
Oh, never mind.
Look, there is the T-Rex monster. It will eat us. It will eat everything. Save me. Save the world.
I don't see dino.
Well, that's the point. There is no dino in reality. The poor lady is behaving this way because she is suffering from schizophrenia.
What?
It's schizophrenia, an important topic I'll explain in today's episode. So, let's zoom in. Schizophrenia is a long-lasting mental disorder that affects a person's ability to tell what is real and what is not real. Though every patient displays slightly different symptoms, however, it generally starts with subtle personality changes, irritability, disordered speech, and the slow encroachment of weird thoughts. Later, people with schizophrenia may also show sudden shifts in emotions, like going from feeling afraid and anxious to uncontrollable laughter for no apparent reason. Along with these, other symptoms may include a lack of emotional expression when speaking, having problems making and keeping friends, and lack of motivation to do everyday tasks. And as time passes, the patient may start to show certain psychotic episodes of hallucination, a condition of seeing and hearing things that are not present. Or they may get delusional about themselves and believe that they are someone important, such as a president, king, or prime minister. Sometimes these delusions can be paranoid in nature, causing unreal fear or suspicion that someone is out to get them, or the person may start to believe that aliens are controlling him or her. Now comes the real question. What causes schizophrenia? Well, while the exact cause of schizophrenia is not fully understood, scientists have identified several factors that contribute to the development of this disorder. And one of the most significant factors is genetics, as people with a family history of schizophrenia are more likely to develop the disorder. Plus, numerous genes also play a big role in its development, but we are yet to identify them. Another factor that contributes to the development of schizophrenia is environmental factors. For example, exposure to certain viruses or toxins during early childhood may increase a person's risk of developing this disorder. Additionally, things like social isolation, stressful life events, and the use of certain drugs can also increase the risk of schizophrenia in highly susceptible people. Besides, research has found that people with schizophrenia tend to have an overactive dopamine system, which may contribute to the symptoms of the disorder. Specifically, too much dopamine activity in certain areas of the brain can lead to delusions and hallucinations. I know what you are thinking. How to treat this serious disorder? Well, unfortunately, there is no solid cure for schizophrenia, but it can be treated with antipsychotic medications combined with cognitive behavioral therapy that can help patients learn to manage their symptoms and improve their quality of life. And if these things fail to work, then electroconvulsive therapy can also be an effective treatment. But the best approach is to detect the early symptoms and make an appointment with the doctor. Remember, my friends, schizophrenia has a lot of stigma attached to it, and the people with this disorder are considered a threat to others. But in reality, they are actually the victims of their brain playing tricks on them. So, be kind to them, show love to them, and do your best to provide timely treatment to them. Trivia time! Did you know schizophrenia affects approximately 24 million people worldwide? Also, schizophrenia is uncommon in children under the age of 12 years and mostly appears between the ages of 16 and 30. Hope you learned something important today. Until next time, it's me, Dr. Binocs, zooming out.